record. Let's see. So I'm Heather Shields. Welcome to the webinar. I'm Heather Shields, and I own Pathways Driving Rehab Services, and I'm an occupational therapist and a driving instructor. And I am going to share my screen with you guys. And let's see. All right, here we go. Loving the technology here. Okay, so I created a webinar to teach you guys about how to guide your patients back to driving. I've got 20 years experience as an OT, and my first job was at River Ridge in Kennebunk. And then I've worked in all different settings of rehab. But brain injury really is one of my favorite things, and it's pretty much anything that could go wrong goes wrong with people when they have brain injury, so I've got a lot of experience. And so I became a driving instructor and then a certified driving rehab specialist, and that specialty is through ADED, which is the National Driving Rehab Association. So it's kind of like you take a national board exam. It's a 200 question board exam where you have to have knowledge about medical conditions and adaptive equipment and driving, how to know when somebody's safe and not safe to drive. So that's what I do with my driving rehab business. What I do is I travel to the patient's home to do the driving evaluation, and then I may do driving trainings with them also. If they need adaptive equipment, they usually need more driving trainings. And for a lot of elderly people, I might do driving trainings with them too, to keep them driving safely as long as possible. So that's what driving rehab is, and what the goal of driving rehab is, just to help people stay driving safely as long as possible, and addressing community mobility and figuring out when people need to retire from driving. So I actually travel to the patient's home, and I'm the only one that does that in the state of Maine. And I go all over the state. So I've seen hundreds of people now. I've been doing this for 5.5 years. So the numbers just keep growing and growing. So what I'm going to talk about tonight is I want to introduce you to the state laws and where you can find them. I'm going to give you a free guide to help you so that you know what to do before you have the patient do any behind the wheel activity. I want you to be more comfortable talking with your patients and having a positive conversation with your patients. And I'm going to introduce you to the online course that I created. So here are some pictures of what driving rehab looks like. Here on the left is me using the Optec vision tester, and this is Valerie. She's a young woman that had a stroke. And here's a picture of me driving with her. We're driving on the highway. And this is just a picture here of some adaptive equipment. This is a push rock hand control with a spinner knob.
Valerie had a stroke on May 30th, 2017. The damage was severe, leaving her with little hope of ever driving again. Her road to recovery is nothing short of a miracle. If a driver's ability to safely operate a motor vehicle has been compromised, it is the individual's responsibility to report that to the Bureau of Motor Vehicles. And like Valerie, they too may be required to take a road test. Even though Dr. Houston cleared Valerie to drive again, it didn't mean she'd be a safe driver. It just meant that her vision had improved enough to pass Maine's Bureau of Motor Vehicles eye exam.
The thought of driving again was overwhelming and scary. Was I ready? Could I do it? What if I fail?
Before getting behind the wheel again, Dr. Houston suggested Valerie work with a certified driving rehab specialist. So we contacted Heather Shields, owner and founder of Pathways Driving Rehab Services.
Thankfully, I had faith, Hope, and Heather to get me road ready. Additionally, Heather communicated regularly with my occupational therapist to help guide my therapy. My first appointment with Heather was a driving evaluation, and it was broken into 3 parts: pre-driving clinical assessment, on-road driving assessment, and post-recommendations. Part 1, pre-driving clinical assessment. Heather tested several things, including strength, perception, sensory, and vision.
We'll go one line up above that. All right, so Z.
Part 2, on-road driving assessment. It had been 8 months since I drove last, and I was nervous.
All right, bye, baby.
So Heather was assessing my visual perception, reaction time, judgment, left turns, and more.
How does it feel?
Just happy.
When you're doing 30, does it feel like you're going faster?
It feels like I'm going fast enough. Part 3, post-recommendations.
You've made huge recovery and you're going to continue to make recovery. I think we almost should wait a little bit.
Heather recommended that I give my brain another month to heal before I started to focus on driving. During that month, I continued to work with my occupational therapist at New England Rehab. We worked on my peripheral vision, divided attention, and visual and cognitive processing. Additionally, Heather gave me homework. She suggested that I use the app Drive Focus to get me road ready.
It was a total of 5 weeks after Valerie's initial driving evaluation before she began her driving sessions with Heather. Left turns, yielding right away to cars and pedestrians.
What are you going to do with these guys?
I'm going to hang back.
Okay.
Lane changes.
Use your mirror first.
Okay.
And look over your shoulder just before you go.
And intersection management.
Green lights, I'm going to go right through it.
These were just a few areas they worked on.
Additionally, Heather taught me how to stack my deck before I got behind the wheel. For example, have a planned route. Eliminate distractions by turning off my cell phone and the radio. Only drive when I'm well rested. And have plenty of time to reach my destination so I don't feel rushed. Even though I still have my limitations, I now have my license and a taste of independence.
Wait, sorry guys. Okay, I'm gonna go back to sharing it. Okay, so Valerie had a stroke, and the OT did a lot of work with her to get her ready to get back to actually do that driving evaluation. And then it turns out that she wasn't quite ready yet because her skills weren't developed enough. But there are a lot of different people that would be getting referred for a driving evaluation. And it's really any of the patients that you work with, anyone that has a medical condition that can impact driving is going to be referred for a driving evaluation. So if they have any impairments, then we want to have them make sure they have a driving evaluation so we know they're safe to drive and they have the protection of being in an instructor's vehicle with an instructor's brake. So all those are the categories of the different medical conditions are called the functional ability profiles in Maine. And I'll go over those with you in a little bit. It's important for you to know that a driving evaluation comes before a road test. We want to make sure that they're safe to be doing any driving before we send them to the Bureau of Motor Vehicles. And it's all of our responsibilities to educate the patient on the risks and their options with driving. In Maine, I'm going to take you briefly to the website so that you just have an understanding of where to find them, but they are, so this is what this looks like, the medical requirements. So you'll come to this website, and I'll send this to you after so that you can go to it. But so say your patient had a stroke, you would look in this category. Stroke is in here under muscular and neurological. And there are different categories: amputation, arthritis, CVA, and then miscellaneous neurological conditions, multiple sclerosis, Parkinson's, spinal cord injury, traumatic brain injury. So it's important for you to familiarize yourself with what these different, where your patient falls based on what their diagnosis is. And then there are a couple of forms that can get sent into the Bureau of Motor Vehicles. This is the medical evaluation form. Occupational therapist can fill this out. It's for any of us clinicians so that we can communicate any sort of concerns. Now, basically, you would want to refer them for a driving evaluation, but if they can't afford it, and they're really not listening to you, and you know they're going to go out and drive, then you want to make sure you send this form into the Bureau of Motor Vehicles. So you're going to put the medical condition here, and then you'll have to check off the box. 3B or usually requires a road test. So this is just kind of to familiarize yourself with this form, okay? But you can also send it to, you can also send your report to the Bureau of Motor Vehicles and have them send it in instead. Okay. All right. So now AOTA and Genesis created these driving pathways, and it is a really nice free resource that I can send you. It has the different diagnoses written down, and it guides you about how somebody with Parkinson's is affected, how somebody with arthritis is affected, like how does that impact driving, and how do you know what to do? Do you refer them for a driving evaluation? Do you recommend no driving? What do you do with this person? So the categories are arthritis, Parkinson's, orthopedic, upper extremity, lower extremity fractures, surgeries, and then neuromuscular, we've got multiple sclerosis, neuropathy, peripheral vascular, or Parkinson's disease, ALS, mild cognitive impairment and dementia, stroke, or a one-sided impairment, cardiopulmonary, and amputation. So I'm going to take you to this so that we can kind of go through this. So here's arthritis, and we could take a look at Parkinson's disease here. So Parkinson's, so this is created for the generalist OT. So you would have an idea of the areas of focus that you need to focus on in your therapy session. These are all the different things that you need to take into consideration. So things with Parkinson's would be processing speed, because it's often delayed, response or reaction time, their medication management. If they've got cognitive impairments, and they may be having trouble with their medication management, and particularly with Parkinson's, you need to make sure that you're taking your medications on time and timing your driving when you're taking your medications. Cognition, vision, visual, perceptual skills, range of motion, transfers, pain. So this kind of gives you an idea of what you can be looking at. You want to make sure that you address all of these things in your screening and evaluations, and then you want to be working on things in your treatment sessions. So here we have a red flag for continued driving. This would be if they have impairments on some of these different tests where you're seeing on tests and functionally they're having impairments, then you would definitely want to refer for a driving evaluation, because we are going to be able to take them behind the wheel, and we may be able to do more training and teach them compensation techniques to help them so that they can be safer longer. All right, so this is a really useful tool. I think you guys should print this off and keep this at your desk because it's really, really useful. You can come back to this over and over again. And then that will also help you how to have positive conversations with your patients too. I have on my website, I have some very helpful resources for you so that you can better educate yourself, and it gives you some really useful guides that you can print off and keep in your clinic. I think I'm going to actually just take you to my website because I think that's honestly the easiest thing to do. All right, so under resources on my website, I've done some different videos, I've done videos on different medical conditions and how they relate to driving. There's some research done when people are falling, their crash risks is increased. This is put out by AAA. This is something that I think is very helpful. We need to talk family conversations with older drivers. This is put out by the Hartford Foundation. When you look through this, you can get a lot of different ideas of things that you can work on in your therapy sessions, and also how you can talk about driving with your patients. So there's a lot of different statistics in here, and very, very useful resource. And then also the Clinician's Guide to Assessing and Counseling Older Drivers is a really wonderful. This is a lot of pages, but I believe I just went to a talk today, Screening and Assessment of Functional Abilities for Driving. This is a very useful section. So there's tons of information in here. I highly recommend that you go over this. And then AAA Senior Driving is a really great website that you can go through with your patients. This is something you can work on during your therapy sessions. And it's something that you can recommend for people at home too, once you see how they're doing with that. Okay, so there's just various different things here for you, okay? This CHORO assessment is something that has been created by the people at the University of New England. Oh, I guess my links aren't working on here. Darn it, I'll have to fix that. And then the Drive Focus is something that is a very useful app too. Okay, those links aren't working either. So I guess I have to fix that there on my website. But these are really, so the Drive Focus is an app. It's only for iPads. This is for people that have had a stroke or any sort of visual cognitive impairment, so that you can work on their visual processing speed. And you can take a look at how they're doing with it in your therapy session, and then send them home with it so they can work on it and do it as homework. Okay, and then this is, so what I was introducing to you is that I've developed a course. I've developed an online course for occupational therapists because I learned that a lot of people just don't really know what to do to help get their patients ready to get back to driving. And I wanted to make it a place where you can go that has everything organized for you, and it has all these resources for you. I've had several people go through the course now, and it has been very helpful to other OTs. This is a really great course for OTs and CODAs who are new or experienced working with clients whose goal is to return to driving. It offers evaluation recommendations, treatment recommendations, and best of all, you have the opportunity to ask Heather and the other course members questions about difficult decisions and complex clients. I highly recommend this course to any OT or CODA who treats clients who want to return to driving. So there are some testimonials here, and I think people have found that really helpful, like the group discussions that we have are really very helpful. And Miriam Monahan is one of my mentors. She helped me putting the course together, and she said that, you know, there really aren't a lot of people doing this in the profession, and there is a need. So the course, if you were to buy the course, this is what it looks like. You log in, and then there are the different, the courses are over on the left. There are videos, and then there are PDFs that go with the videos. And I'm going to take you in and actually show you what it looks like. All right. So you just start the class, and there is no time limit on this. This course it's an online course. You can go at your own pace. There's about 2.5 hours of videos and a lot of different documents, PDFs, helpful documents for you to print off and keep at your practice. Now, so there are the videos, and I'm going to take you through one of these are the different modules. Okay, so here we have the video. Oh, I'm gonna take you to a different one. Let's do this one. This one doesn't have any documents. Okay, so here's a good example. So here's the video that you can watch. And I go through all of the different skills that you need for driving. And then over here on the left is a bunch of different resources for you that you can use in your clinic. There are different evidence-based research and screening tools. There are useful tools that you can use in your therapy sessions. This adolescent skills checklist is a great one. The executive function performance test, the safer driving, the enhanced driving decisions workbook, the driver performance test, which is a video series that you can do with your patients. All of this stuff are things that you can do in your therapy sessions. It's all billable time that you can be including with your patients. And then this is so I cover the state laws. There's a section on vision and how to assess vision. And then there are websites for you that you can learn more about different visual retraining activities that you can do with your patients. There are lots of resources, books, and things that you can get for your clinic. Let's see here. And then there are useful pathways. The pathways that I talked to you about earlier are on there. A few of those different tools that I gave you, many of these things are from AOTA, and they are free resources, but they're all put together for you in one place. And then I've also put together information on AOTA's older driving program, free resources that they've put out, things from ADED. I've put together community resources in Maine. There are case studies, and then we have done live Zoom calls like this where people can ask questions, and there's also a private Facebook group so that people can problem solve and talk about things in the Facebook group. So that gives you a little introduction to that course. Let me just go back. Let me go back one more time. Share. All right, so there's 2.25 hours in videos. They range from 4 to 33 minutes each. The state driving laws is the longest video, and you will have lifetime access to the course, so you can always go back to it. It does take people a while to go through this. And many times people have to watch the videos more than once because there's just a lot of information, and it's something that you don't do on a regular basis. So it's like you're learning something new. The Zoom calls are a place where we get together just like we're doing tonight, and I answer your questions, and you will have lifetime access to the course. So the price of the course is going to be $97, and there will not be continuing ed units attached with this course. I did have the course more money, but basically all right, here we go. None of this back and forth. Okay, so I really wanted to get this approved for continuing ed units, and to get a course approved for continuing ed units through AOTA is actually like just so much work that it's just not worth it to me. I have to monitor you've got to have completed each video, and it's just too much because I can't really monitor that with people having lifetime access to the course. So I just am making it $97, which is so cheap, and it's going to give you so much to do in your therapy sessions. I mean, you'll make that back in no time at all because you're going to have so much to do now with your patients that you didn't know how to do before. So what I want you guys to do is just unmute yourselves and start asking me questions, because that's going to be just the best thing.
One of my first questions is, in the clinic, what would people be using for CPT codes?
Well, so what you need to do is you can't be documenting driving in your documentation. You need to document the skills that you're working on. So you're going to be documenting on vision, visual processing, visual scanning. You're going to be working on attention, cognitive processing. You might be working on movements in the arm or the leg or whatever, but you don't want to be documenting necessarily that it's about driving, because the insurance companies don't pay for driving.
Right.
You can document, these are things that they need to do for cooking, right? So you can be observing them functionally. The thing is with driving, getting somebody ready to drive, you need to challenge them. So like Valerie, you saw Brian working with her. He worked with her for months to get her ready to do that. All of that stuff is all billable, and it's skills that work on other things, not just driving. And I know that with ADED, that's something that I could actually definitely add to the course, is about documentation. Because that will be helpful for you guys.
What is the price of one of your driving evaluations? What's some information we could give people?
Oh yeah, sure.
About your services?
Yep. So the driving evaluation is $450. And then I charge 54 cents a mile round trip for a travel fee from my house to their house. Now, so I do a driving evaluation. Alpha One and New England Rehab all do driving evaluations. The difference is that I travel to the patient's home. It's so much, I think it's more beneficial because it's so practical. I don't have a set route. I take them where they go, where they drive. So you're really looking at how they're problem solving. And the other thing is I follow people through with driving training. And that is something unique to me. So like Colleen and I were chatting, I don't know if you were on earlier, but Colleen and I were chatting because she's starting a program in Massachusetts. And they have to use a driving instructor because their program can't afford, I'm assuming, Colleen, your program doesn't want to get involved with buying a car. You have to have a driving school and insurance and all this stuff. So the driving instructor, they try to help the patient out, but I'm helping them, but really what we want to know is this person safe and can they problem solve? That's ultimately, when they're by themselves, guess what? They need to stop at a stop sign, or they need to make sure they're scanning. If somebody had a stroke, as a generalist OT, you've got to do everything in your power to get their visual scanning skills going, and you've got to know how to assess their vision. You've got to know where to refer them for a driving not a driving, but you need to know which optometrist to send them to. You can't just send them to a regular eye doctor. And that's something that I teach in the course is about that. Because a lot of OTs don't have that training. And they're just, we all do what we know how to do, right? But if you haven't had that extra training or you didn't have that mentor, you can only just do your best. And when you work in home healthcare, a lot of times we just wing it, right? When we're like, okay, what am I going to work on today? Okay. But if you kind of know in your mind, okay, I need to work on this and this and this, then you can incorporate it when you're winging it. Because in your mind, you're like, okay, I got to check off that. I know I got to keep working on this. Do you know what I mean? How about some other questions from you guys? Colleen, you just started, so you're just starting a program. Talk a little bit about how did you get prepared to start that program?
Well, well, I'm doing this webinar. I'm definitely going to be taking your course. And then we have somebody who's been doing driving evaluations in our current setting, but she's old school. So she's using a lot of like formalized assessments and things like that. So I'm just trying to get all the visual scanning, the visual assessment. We had an old brake and gas reaction timer, just kind of fine-tuning our evaluation and fine-tuning the process with like I said, with the driving instructor, where he was doing so much coaching. And I was like, whoa, like they weren't stopping at stop signs. They pulled over, like almost hit snowbanks. And he's like, can I pull over nice and slow? And I was like, Jesus. He must have lost 3 hubcaps. I've gone to the course on the Cape.
Yeah.
Just really dabbling. There's so much resources that I'm just really just dabbling in as much information as I can and trying to bring it back and make something custom.
Yes.
I'm in a very rural area.
Yeah.
Doesn't have a lot of specialties and specialists like an optometrist. That's a huge issue for us in our area. Like we don't have one. We had one optometrist who passed away like 5 years ago and who did all that training. And so we're trying to just how to benefit our patients the most. And we don't have access to a lot of public transportation that's accessible and easy and affordable. I don't live in a city, so I don't have Uber and and things like that. I have Uber, but it's not accessible.
Well, so that's one of the great things about the Facebook group is that we can help support each other. So when you buy the course, you get it's a private Facebook group only for people that have bought the course. So it's an opportunity where somebody could come in and say, like, I have this patient and I notice these significant impairments and their kids are pushing for them to drive or whatever the situation is. But where you're like, I don't know what to do. Could somebody help me out? That's what I can help you do, because I did that for so long. And patients are tricky, especially the ones with cognitive impairments. So we need to know you got to engage them in your therapy session, and you've got to educate them. And when you can say, look, I know that you want to drive more than anything, but you just knocked into the door, and you've had this left neglect for such a long time. And I also noticed in the gym the other day, you got so distracted when you were tired, you couldn't even focus on what you were doing. How are you going to drive? Well, we need to work on this more, because your brain isn't ready yet. But we are going to work in therapy and help you. You'll get there, but it's going to take you longer.
We're doing more of that, is adding therapy because we had a patient recently that had a lot of visual neglect, and we're like, you just need training. You need to come in here for a few months. You haven't had outpatient rehab.
Yes.
And then they open up and say, yeah, I'm missing things and I'm losing things. And I know how to drive. I know you know how to drive. That's not the issue. I'm not teaching you how to drive. I'm making sure you're safe with the skills that require you to return to the road.
Yeah, you just don't know how to look to the left and see if pedestrians are coming. So maybe we should work on that. And no, that's the thing. Like when you can link the impairment, so it's not the person's fault, it's the stroke. It's or the multiple sclerosis. Like people with Parkinson's and MS, they wait way too long to get a driving evaluation because they're afraid of losing their independence. But as occupational therapists, we can have a majorly positive influence in their life, and we can give them so basically if you can educate them, and then you figure out when they are ready for the driving evaluation, then you refer them to me and I take them out. I have some great testimonials on my website. I also have videos of the adaptive equipment training, so you can look at that with your patient so they can not be so fearful. People are fearful of getting their license taken away, but when they can see how they could be safer, then they want to do the right thing. And there's also ways to get the driving evaluation paid for through vocational rehab services. And there are some grants out there, so I can help you figure that out. Some other questions you guys have?
I feel like I have a lot of people that are like, well, I only drive like right around my house.
Yeah.
I stopped driving like too far away, but I feel like that's just as bad. Like if you've stopped driving that far, then is it really safe for you to be driving right around your house? And it's always a hard conversation.
It is. But
do you have any information on
on the website, like how to talk to older drivers has some really helpful things. So what I think is helpful is when you understand better the skills that you need for driving and those skills that are lacking in your patient, you can educate them on why you need that for driving. You need to turn around and see behind you when you're backing out. Where do you only drive a little distance, but where do you park at the grocery store? Do you back out? Well, your reaction is so slow. What if somebody leaving the grocery store wasn't paying attention to you? Could you react fast enough? And you can give them things you can simulate things as much as you can in your therapy sessions too. It's a lot of education.
Yeah.
But you as an OT need to be better educated to know the different angles that you can take with your patients. Because when you got that skill set, remember when you were first learning, you didn't have as many tricks in your back pocket, right? Then you started learning tricks and you're like, okay, I know exactly what this patient's going to say to me right now, and I've got an answer for him. That's what my course is going to help you do. And your facility is going to make more money because you'll be able to keep them in therapy longer. Any other questions out there?
I think so.
Go ahead.
Yeah. Did you consider, I was wondering about the Massachusetts person, maybe consulting optometrists like with telehealth? Would that help your problem? Specialized optometrists, do any of them have access telehealth-wise that it could work for you?
Yeah, we're looking into things like that. Yes, definitely. Yes.
The problem with optometrist is you've got to see an optometrist who knows how to evaluate a neurological visual perceptual impairments.
Right.
That is hard to do over telehealth. But,
okay.
But there's specialists in Massachusetts for sure. And I go over that in my course because I give you the website to find the national website to find those specialists.
Mm-hmm.
Good. Thank you.
You're welcome. Melinda, do you have any questions? Well, you guys, I'm here. If you ever need me, I want people to do a better job talking to their patients, because you know what the patients say to me? They say, no, and this is after they've been in the hospital, they went to rehab, they went to skilled nursing, and then they had home health, and then they had outpatient, and they said, nobody ever told me that I can't drive. Because people don't know how to talk about it, so they don't. And there's a lot available for us to help our patients. And I'm always available to talk with you over the phone. Call me up. I'm in the car a lot of the time, and I'm driving long distances. Call me up and say, like, hey, I've got this patient. I've done this and this with them, but I'm still not sure about this. And I'll say, like, okay, well, what about this? What about that? Or, sometimes we get stuck and we just need a little, you just have to bounce it off somebody. Mm-hmm. So I'm happy to be that person for you. I'm also happy to come in and do in-services at any of your facilities too for the people in Maine. Even Colleen, I would, just because I love you, I'd come to the Berkshires too, because I've never been.
Like Monk Greylock with your dog.
Yeah.
I think one of the struggles at my facility is that I just feel like doctors, maybe I'm trying to place blame, but I don't want to be the bearer of bad news. And I don't feel like doctors are maybe picking up on things. I had a woman with rapidly advancing ALS who sat in a parking lot for 35 minutes because she couldn't get her door open. So just decided to drive back home. And we had the conversation with husband and people like that, but she was being seen by specialists in Boston and specialists out of Maine Med. And I was just amazed that nobody had this conversation with her. And then she had moved, so I just didn't know how to break that ground. So it sounds like the course would be helpful in figuring out who to talk to or
yes,
make a referral.
And you know what it is? People don't understand. They're like, I just talked to a doctor today. I went to a talk up in Rockland, and she's a hospitalist, and she was like, I don't know what form to fill out. Like, am I allowed to do this? Yes. The Bureau of Motor Vehicles isn't going to know anything until you fill out their little form and send it in. That's the only way that anything is going to get communicated. And somebody that has advancing ALS, somebody should send it in that says, no driving. They're not safe to drive anymore. And even you can do that. And as an OT, it's okay for you to do that. But I think what is helpful is if you call the doctor's office and say, whoever the top specialist is, the neurology department probably, call and speak to their nurse and tell them, look, I know you're following this patient. She just sat in the car for a half an hour because she couldn't open the door. It is no longer safe for her to drive. So do you want to send the form in, or do you want me to send the form in? But one of us needs to take responsibility because she is at risk for hurting herself or the community. People just basically don't have balls, you know? They don't want to take the responsibility, and it's annoying because, you know, this story happened last summer in Maine where this woman lost both of her legs because she was pinned between the car. An elderly man should not have been driving. He didn't know it, but so the doctor sent in the form to the state, but he didn't probably open his mail, so his license got suspended because he didn't show up for the road test. He had neuropathy in his feet, and he had cognitive decline. And this woman saw him pull in the parking lot. And she said, I was at the dry cleaners, and I saw this man pull in, and he was all like parked crooked. And I thought to myself, what is he doing? And so she watched him try to rearrange himself in the parking spot for a while. And then she finally got out of her car to walk into the into the dry cleaners, and he hit the gas instead of the brake so hard, and it pinned her between her car and his car. Her legs had to be amputated. She's an amazing woman, and I've actually reached out to her because I am sharing her story, and I'd like to share it even more because I can help the elderly man, and also I can help people like her that, you know, need adaptive equipment. But I want everybody to know this story, because if somebody had the balls to go in there and do something about it, remove this guy's car, talk to the family, like, you got to go above and beyond, then maybe a situation like that could be avoided in the future. But it's because if we don't speak up and say something, that person with the cognitive impairments is not going to make the decision because they don't have good judgment. So that's our job. So on that note,
You always make it sound so easy, Heather.
yeah, well,
I know because of experience. It's opening up my back to tricks, and it's scary. You think back 25 years ago when you just started, and you looked at the OTs like, how did they just do that? And now you're one of those. Now I feel like now I'm back 25 years ago, and it's scary.
I know. It's scary when we don't know something. I hate not knowing stuff, and I hate I have to see this patient. I don't know what that means or, you know, what to do, but we can learn together. And, you know, before I started this, I had no idea. In Maine, it's not really black and white. So I was like, wait a minute. I mean, shouldn't we do something about this guy? Even the people at the desk are saying, this guy drove to therapy today. I don't think he should be doing that. This is like the secretary saying that. So there's a whole lot to it. And if you know what to do, you'll do the right thing. You just need to know, and you need to have your steps to take. And then it's easy peasy after that. So I'm going to send you guys all an email. I'm going to send you a link to the sales page for the course. You guys can share it with your coworkers. I'm happy for you to share it. You know, before in the past, I had done these Zoom calls like one a week for 4 weeks, but I kind of think it's too much for people. I'm going to just kind of do the Zoom calls. I might just send out a group email and say like, hey, I'm going to do a Zoom call, maybe like once a month. I think that might be more doable. And if people want to do it before that, just reach out to me, because then I can reach out to the group and say, hey, somebody wanted to do a Zoom call tonight about this topic or whatever. And then, you know, we can set aside a time to do it. But the Zoom calls are where we can come together and be like, okay, you know, it's like where you can apply the stuff from the course and then start to integrate it into what you're doing. And the Facebook group will do the same too. All right, so if you need anything, just let me know. I'll email that out to you tomorrow.
Awesome, thank you.
Thank you for coming and staying. I'm so excited. And thank you for the potential referrals for driving evaluations. I'm grateful for that.
All righty.
All right, see you guys. Good night.
Heather.
Bye.